Hi, day 2 of my ACL surgery recovery, and I thought I'd actually shoot a daily video just showing my recovery from this ACL surgery, not necessarily for my audience, but for anyone who happens to find this and they're having an ACL and they have to recover from it. So yes, I had the for those who didn't know, I did have a ACL, the cruciate ligament replacement in my knee. They took the hamstring out and then they used my hamstring to replace my cruciate ligament. And this is the second day, and my leg is still, I think it's actually more swollen than originally. I don't know, I'd have to compare it, but it seems to be more swollen anyway. And if I just sit here like this with my knee in a neutral position, there's actually no pain at all. It's only when I try and do something with it. And I went to physio yesterday afternoon and that was painful. She made me do full range of motion and stuff like that. I had the TENS machine on there to numb it first so that she can move it actually through the full range and things like that. I have to get myself a TENS machine. It should work a treat. Anyway, and one interesting thing is that when she actually moved my knee back and forth, I was moving it back and through a much larger range of motion. You can actually hear the fluid inside the knee. Believe it or not, it was really quite loud. I could hear it as well when I was lying down. You can hear the fluid inside the knee, and she hadn't heard that before. She was quite surprised, but I confirmed with the surgeon, and yes, that is actually normal. Sometimes you can actually hear the fluid inside the knee because it's all swollen and everything else. So I think it's more swollen after the first rehab. So the first physio session. So I've got physio again on Monday, but I've got daily exercises. I've got to do a lot of reps of various things. I'll show you one in a minute. But anyway, I'm doing okay. I'm not I didn't take any drugs last night to help me sleep. I'm just on, if you're curious, I'm just on regular Panamax, which is just Panadol. And I'm on Moxicam. There you go, Moxicam, which is an anti-inflammatory plus pain, but I think it's mostly for the anti-inflammatory. And I do have nausea tablets apparently, but I've had no nausea whatsoever. Apparently a lot of people get nausea. I haven't had to use it at all. I've been, even straight out of surgery, I felt fantastic. In fact, they were, I was that talkative guy. Word got around that, geez, that guy's talking a lot. I was real peppy after the surgery. But yeah, the knee actually felt worse this morning. I felt better on the morning after the surgery. Maybe I still had some drugs in my system from the drip that they put in, but yeah, the knee felt worse this morning, but I've iced it up. You have to keep icing it several times a day. That's important. And just in case the pain gets too bad, I've got Endone. It's a controlled drug. There you go. So that's serious business, I believe, but I haven't had to take that. The pain's not that bad, but it is pretty annoying. By the way, I didn't tell you about the surgery. The hospital, actually. It was really cool. My anesthetist, if I'm pronouncing that correctly, it's a hard word. Anyway, he was a cool old greybeard. It was fantastic. He was great. It was absolutely awesome. He was an associate professor, actually. And the nurse I had, she was fantastic. She was actually an XKCD nerd. She obsessed over XKCD, so it was fantastic. I couldn't have had a better crew for the surgery. Anyway, just wanted to tell you that. I was so surprised to be in there talking nerdy stuff. It was fantastic. Anyway, this is one of the physio things I've got to do. Here we go. Let me show you. Simple towel pulls. Sounds very simple, but I have to do a lot of these reps a day. Put a towel around here. It's a closed chain sort of exercise where I'm trying to get flexion in the knee but without using the muscles, without having to use the muscles, because at the moment we're trying to get, it's important to get range of motion back in the knee and not actually building the muscle. The muscle building will come later. The most important thing at the moment is range of motion. So I can, pull that up. That hurts, right? So if I have to do hundreds of these reps, it takes it's much easier now that I've iced it. I iced it about 20 minutes ago, and it's much easier now, but there's a lot of stress in here. Like, I can feel the pressure in my knee, and it's really, I can take it more than that, but wow, that pain, it's not so much pain, it's real pressure. The amount, it feels like your knee's going to burst. There's so much pressure inside of here. It really is quite unsettling. It's like, the other knee, I could do, 1,000 of these reps a day. But the other one just doesn't move as quickly. I can do it under my own strength, but geez, that is the amount of pressure in my knee. It's just because of the swelling is all still there. But anyway, I've got to do heaps of those. I have to do like a skateboard thing, and I've just got to do just put it up like on a box and just leave my knee hanging like that, because it's important to get back hyperflexion in your knee, up to 4 degrees, she said, 4 degrees hyperflexion. So yeah, I've got to work on that. But apart from that, it's tough. Rehab's not easy, but that's what they say. It's all about the rehab. Like, you might think, because it's so swollen so hard, like the natural thing to think is, I'll just let all the swelling go down first before I start the rehab, but apparently that's not a good thing to do. You're supposed to start rehab like the next day. That's why they tell you must go to the physio the day after the surgery, and you've got to push through the pain, and that's why they give you serious drugs and things like that. One thing I didn't do is I didn't take the Panadol. I'm not taking much Panadol. I'm only taking a few of these a day. I probably should be taking more. I can take up to 12 or something. Sorry, no, 8. I can take up to 8 of these 500 milligram Panadol. It's just regular Panadol. It's not, but I usually don't take drugs for anything at all. I have to be in really serious bad condition to take anything at all. But I probably should take those like half an hour to an hour before going to rehab. So there's a tip for young players. But yeah, I don't go back to rehab until Monday. But until then, I've got just exercises all day, every day. So it's fun. So this is my ACL recovery day 2, and I can walk around at the moment. I couldn't this morning. Well, I could, but it was really, even on crutches, it hurt when I first got up because my knee seemed more swollen. But, once you start icing it and things like that, it gets better. Moving it around helps. And yeah, I'm probably, it's the middle of the day now, and I'm getting back to where I was yesterday. So yeah, it's a bit of a struggle. It's not going to be easy. This is going to be a long road back. But anyway, that's my ACL recovery day 2, and it's pretty good. I can just sit here, no pain. So it's, as some people have reported that they had ACL and they were in excruciating pain for like a week after the surgery, and wow, I wouldn't like that. But yeah, even the day after, after the surgery, I felt really no pain at all. It's only when you move your knee or start trying to do stuff, and I'm only getting around on a single crutch. I don't need 2 of them. So it's better if you can get around on one or not at all. I'll probably only use the crutches for the next couple of days or something like that. We'll see how it goes. But anyway, that's day 2 ACL recovery. Catch you next time.